Hello, my name is Douglas Bloch. I'm an author and a depression survivor. Welcome to another edition of One-on-One with the Depression Counselor. In today's session, I'd like to talk about something I've been concerned with for quite some time, and that's the way that depression and other mental health disorders are treated by the mental health system in our culture. And that is that antidepressants, drugs, are usually used as the first line of attack. For example, let's say that you were feeling depressed or you had a friend who was feeling depressed. Either you or he or she would probably call up your primary care physician, make an appointment. The person would sit down with you and take out a list of possible prescriptions, Prozac, Zoloft, Celexa, and offer to prescribe it to you. Now, they wouldn't ask you anything else about your life or what's going on. They just say, which of these antidepressants do you want to try? Now, the problem with this is threefold. First of all, recent studies have shown that antidepressants often are no more effective than placebo pills, or maybe they're more effective, but just a little bit. Secondly, many people have side effects from these drugs that are so unpleasant they have to stop using them. And thirdly, even when they do work, there's a phenomenon called Prozac poop out, in which a drug will stop working unexpectedly for no apparent reason. Now, there's an alternative to this approach, and that is using antidepressants not as the first, but as the last line of attack. What would replace it? What would come first? A holistic treatment program such as the one that I and others use and what I write about in Healing from Depression, 12 Weeks to a Better Mood. Now, it all starts with what I call the 3 pillars of mental health recovery. 1, set the intention to heal. 2, reach out for support. And 3, use a combination of mutually supportive therapies to treat your symptoms. Like I like to say, intention plus tools plus support equals mental health recovery. Now, what are these mutually supportive therapies I speak of? I break them down into 5 categories: physical self-care, mental emotional self-care, social support, spiritual connection, and lifestyle habits. When you put into effect all of these ways of treating your symptoms, you're using a multimodal, holistic approach that doesn't just depend on one thing, you greatly increase your chances of feeling better and making a full recovery. Now, under physical self-care, I list things like exercise, sleep, nutrition, supplements, but I also list antidepressants. In other words, I'm not opposed to antidepressant medications. For some people, they do work, and they work very effectively. It's just that you shouldn't use them all by themselves or rely on them alone. And if you do use them, you should use them with other sorts of treatments like we talked about. Now, when you think about this holistic program I outline and other people outline, do not think of this as complementary or alternative, because we are physical, mental, social, emotional, and spiritual beings. This is who we are. And so when you treat depression or any other dis-ease, you have to go to the heart of what it means to be a human being and work on all these 5 levels. So I hope I've explained why I think that drugs are important but should not be used by themselves. Thank you for watching this video. And until we meet again, remember, it takes more than a pill to heal from depression. Thank you.